Hi guys, my name is Dr. Diego Martinez and I'm a colon and rectal surgeon in Houston, and I help people deal with colon cancer, rectal cancer, inflammatory bowel disease. But today we're going to talk about coronavirus. We have a guest, his name is Dr. Mohammed Khirfan, and he is an infectious disease specialist who is in the front lines treating patients with coronavirus. We want to ask him what are the practical implications for people out there wondering if they can go out for a walk, if they should wear a mask, or if they should wear gloves, or where are we with the political situation. So we're going to be asking him these things. I'm excited about talking with him, and I really appreciate him taking the time to answer some of the questions about coronavirus pandemic in his busy schedule treating these patients. Hey, Mohammed. Thank you for joining me today. I was telling the guys here, you are an infectious disease specialist. How long have you been in infectious disease?
I started my fellowship in 2013 and got board certified in 2016. Since that time, I've been practicing, since I finished my fellowship, I've been practicing in Methodist Willowbrook Hospital.
So we're obviously all very concerned about what's going on. It's nothing that we've ever seen in our lifetimes. How did we as a country prepare for this? Did we do, as soon as we started hearing what was going on in China, on December 31st of 2019, some cases of atypical pneumonia started popping up in China. On January 7th, the World Health Organization published saying that COVID-19 was responsible for these cases. How did we prepare when we started hearing those things?
Okay, let me just mention one remark, please, before I start, which is I'm a physician. I'm going to talk about clinical stuff. I'm not going to go into politics. But unfortunately, I mean, this thing has been politicized in an extensive way. And obviously, the issue about the pandemic was not handled properly. If you want to handle this thing properly from the get-go, you would have to block the economy, which is something a lot of countries did not do. Pretty much this thing, this whole pandemic got the whole world, with by surprise. I mean, nobody expected this. We didn't expect something at this level or at this huge scale. I think there was a lot of delay with the Chinese government realizing what was going on. And if you go back to the media from that time, you can realize that they mentioned that there was no person-to-person transmission, which kind of delayed the response for a long time. And it turns out that there is a lot of person-to-person transmission. Basically, let me put it this way. I get to a point where I don't really trust the numbers coming out of China. You can see, I mean, by the time the pandemic was already in Europe, there was no preparation. You can see what happened in Italy. You can see what happened in Spain. I mean, Italy, basically, there was shortage of ventilators. Doctors had to choose who gets put on a ventilator, who doesn't. In the United States, we had a delayed response, but it wasn't late enough to cause a catastrophe like the one that happened in Italy. Things should have been handled more swift, more brisk. Especially we were seeing what was going on in Italy, in Spain, in England, and we saw the pressure, the volume, and the real size of this pandemic.
Now, when you talk about comparing our situation with Italy or with Spain, are you referring to not just the number of cases, because obviously our number of cases and our number of deaths is higher than Italy and Spain, but more as far as allocating resources, preparing hospitals, canceling certain types of elective procedures and patient visits to have more resources, personal protective equipment to deal with what was coming. Is that what you're talking about?
Pretty much, yes. And there's one thing we have to pay attention to, which is when you want to compare, you have to compare apples to apples, oranges to oranges. The population of the United States of America is close to, the registered ones, including illegals, closer to 400 million people. Okay, the population of Italy is like 60 to 70 million people. So when you say they had like 20,000 fatalities and we are running into like 70,000 fatalities, I mean, you should correct the number for the population. So I'm not telling you the situation here is great. Okay, I'm not telling you that we did a great job. Basically, we had more time to prepare than Italy, than Spain, and we started social distancing a little bit earlier. It should have been started earlier, but definitely, I mean, our response compared to that of Italy or Spain was more quick. No thanks to the leadership here, but basically because of distance. I mean, the virus first goes to, crosses to Europe, then to our region. Again, I mean, this virus is very unpredictable. I think New York is being hit really bad. Here in Houston, in Texas, we're not that bad. Last time I reviewed the numbers, there was something close to 700K cases in the United States, 250 in New York.
Yeah, I was just looking at the numbers in Harris County, and we are having single-digit number of deaths per day, which is I mean, in relationship to other places, fortunate.
Yeah.
But let me pick your brain. You are an infectious disease specialist, so you know a lot about bugs, and I want to know what is different between COVID-19 or SARS, CoV, coronavirus, all the different names for this virus, and other seasonal viruses like influenza or H1N1 or the avian flu, all the others that we've seen.
Okay, let's start comparing this virus to the influenza. We do have a lot of infections with flu. We do have a lot of fatalities, but it's usually less intense for several reasons. Number one, we have a vaccine. I mean, we've known these viruses for ages. We are very familiar with them. In addition to having a vaccine, we have medications. The other thing is when you compare to the flu and to the other viruses, the infection rate was not that high. This virus seems to be some kind of mutation that just spreads like fire in the forest. It just hits everything, and this is the problem with this virus. I mean, if you look at the numbers, I mean, honestly, personally, I'd rather get this virus rather than get swine flu, okay? Because swine flu is going to make me very sick. This one, for somebody who's healthy, who's not a smoker, who doesn't have any chronic issues, I mean, basically it's just going to be a problem like some runny nose, a little bit of dry cough, things like that. But where's the problem? The problem is that this virus attacks a lot of people. I mean, it has a very high infection rate. So when you have a virus like this in the community, you're going to have your healthcare system jammed with so many cases in such a short period of time. Mm-hmm. And this is exactly what happened in Italy. This is what happened in Spain. And this is what's happening right now in New York. I mean, if we didn't do the curfew or the social distancing and we didn't do all those measures, let's imagine together what would have happened. A state like New York has close to 50,000 hospital beds. If things were not handled the way we're handling it right now, New York would need up to probably 150,000 hospital beds. That's 3 times the capacity of the state of New York, number one. Number two, you're in a hospital and you know that when we have, when we count the beds, usually the ICU beds are only like 10 to 15, maximum 20% of the hospital beds. In COVID-19 infection, you have to reverse the ratio because everybody is, presents to you pretty much with respiratory failure. So they need intensive care monitoring. So you're gonna need more ventilators, you're gonna need more ICU beds, you're gonna need more respiratory support devices, all of that at once. So basically, no healthcare system in the world, no matter how advanced, no matter how sophisticated, can keep up with such a burst in numbers of patients. I mean, the system would just collapse.
So you touched a little bit on testing. Where are we with COVID testing? What tests are available? Who are we testing? And who should get tested?
Okay, let's talk about testing, which is basically uh, the I think testing is the tool that's going to help us open up the country. The available test right now is the nasal swab, and they're talking right now about the new one, which is the basically you spit in a cup and they do it like the rapid test, the one that comes back in like 15 to 30 minutes. The one that I have been tested with is the nasal swab, which is basically they go with a swab and they go to the posterior nasopharynx. They take the sample from there and they send, and it takes like probably a couple of days. How accurate the testing is, I mean, it's kind of controversial because when you read the literature, they tell you that it should be 97% accurate, sensitivity, okay, which is, makes it a great test. But in real life, I've been seeing a lot of, I'm talking about my personal experience. I haven't done any statistics. I haven't done any organized work, but I'm just telling you about what we find. A lot of patients actually happen to test negative, then they test positive again. We had a couple of ICU patients who initially were diagnosed as negative, okay, when their respiratory distress got worse or they had a worse repeat radiology, they ended up testing positive. So how accurate is our test? I think this thing needs more workup, okay? But for now, I mean, we have to deal with what we have. I mean, I don't have numbers, but I have to believe in the test because it's the only tool I have. The other tool they are looking into is the antibody test.
Yes.
Now, the antibody test, again, there's a lot of controversy. Some people say that if you have the antibody, it doesn't mean you're immune. Now, I don't know what antibody they're talking about because I know if you have IgM, probably you're still having some virus and still shooting the virus. But if you already have IgG, I think you are immune. But again, there's no fixed data about this. Now, let's talk about the benefit of having these tests. I mean, we hear it on the news all the time that there's not enough testing, that some governors are asking for, large-scale testing so that they can open up. They needed to test all the healthcare workers, truck drivers, store workers, teachers, so that they make sure, that everybody who's back to work or back to normal life is not infected. Still, I mean, as I told you, some people tested negative initially, ended up testing positive, number one. Number two, I mean, if you want to compare it to other testing, let's say I tested you right now for HIV or hepatitis B or hepatitis C, okay, and you didn't have any high risk behavior, okay, and you go back to work, and I know you didn't have any high risk behavior. I mean, if I test you a week later, I mean, you're going to be negative for hepatitis B, hepatitis C, and HIV, okay? This is not the case for COVID-19. If I test you right now for COVID-19 and you're negative, and then you go and you mingle with people who are positive, 2 days later, you will test positive. So this is the question, is how many times do you need to test people? I mean, there's no guidelines, there's no data. I mean, this country has 350 plus million people. I mean, how many tests do you need to have to test everybody more than once?
Yeah.
This is the question.
And for those that are listening in and are not in the medical field, we're talking about the testing that's available and most widely used right now is a PCR test. They swab your nose, they send it to the lab, and they check for the presence of the viral RNA. And then the other test that we talked about is the antibody test, is where the patient goes and gets their blood drawn and they look for the antibodies in the bloodstream, which means that your own body, the patient's body, already created antibodies against that virus. You mentioned IgG, immunoglobulin G, or IgM. IgM is faster to develop. IgG is a little slower to develop, right?
Yeah.
Okay. So as far as testing in the news, I saw that there are a couple of drive-through places in Houston that are testing anyone that drives through, anyone that's a little concerned, anyone that wants to get tested. What have you heard about this? Is this true? Is it worth it?
I mean, honestly, again, let's go to what I said at the beginning. There are no guidelines. I mean, this thing, hit us out of nowhere. I mean, nobody expected it. When we saw it coming, it was too late. So no guidelines, nothing documented in books as this is what you do. So everybody is kind of improvising. I think this virus is going to be pretty much widespread. It's going to hit a lot of people, if not all people, then most people. The target here is not to prevent this virus from infecting us. It is trying to flatten the curve, decrease the spread so that the healthcare system can handle it. Okay. I think there is a lot of unnecessary testing that should be avoided.
Yeah.
Okay. If you can quarantine yourself for 2 weeks, you have mild symptoms or you have no symptoms, I mean, just do it. Social distancing, that should be enough. I think we should save these tests for people who are high risk, number one, or who need to help other people. And we need to make sure that they are testing negative, like healthcare workers, like, school teacher, like, bus drivers, like people who deliver the mail. I don't think everybody should be tested. It's kind of impossible. It's waste.
Yeah. And I've seen a wide variety of reactions from people towards what's going on. I see some people are saying, I'm not even going to go out for a walk. And I see, and they're wearing a mask and they're wearing gloves. I see some other people that are saying, as long as I keep my social distancing, I wash my hands, I sanitize, I can continue to be safe. At this point, we have not reached, the numbers are not decreasing. We're still probably at the peak or about to reach a peak. What would your recommendations be? I mean, politicians are saying things about wanting to reopen business, restart the economy. What should as a society, our reaction be and our action plan be as far as being out there doing things, exercising, considering going back to work if we're not high risk and things like that?
Again, this thing is extremely controversial. I mean, you look at the news. I mean, you can hear 10 different opinions in 1 minute. I mean, that's how controversial it is. I'm going to talk about what I think. What I think is we open up completely when we solve the problem. I mean, I'm sure you travel to so many places and you saw, like, when you're on a plane, usually it's shoulder to shoulder. When you are in a bar or a restaurant or something like that, it's packed. If you want to do social distancing in these places, it means like a restaurant should have pretty much 1/3 of what usually, serve, which I don't know how financially they're going to be hit, but they're going to be hit bad. So to open up completely, I think we should have a solution for the problem, either an effective vaccine or treatments, okay? And that has not pluralized yet. I mean, it's still cooking, okay? Now, to open up for what we call essential businesses, I think we should do that. I mean, you cannot keep the country closed, but you should do it extremely carefully. Look at what happened in several countries. You can't get much news from China, but my understanding is that there is a second resurgence of the disease in China. You can get information from South Korea, and there are some foci of infection in South Korea that happened after they controlled the first wave of the disease because they opened up too quickly. So I think we should open up, and that's why I was telling you, when we were discussing the previous point, that we should save the testing we have to people with essential businesses, like healthcare workers, school teachers, people who work at stores, things like that. Yeah, we should open up, but we should open up very, very carefully and gradually. trying at the same time to deal, like, if we have a documented case, we do like tracing, for contacts, things like that, trying to quarantine them. And it's a long and agonizing process, but it needs to be done to control the disease. I mean, you don't have another option.
I heard someone saying that that everyone's going to get it. He was saying, I think I'm just going to go and get it now. Might as well get it out of the way and then get immune to it and not worry about it anymore, because he's low risk, he's healthy, and he's in his 30s. So, of course, I said, no, that there's no proven immunity. Don't do that. And I'm sure you agree that we will not recommend that to anyone.
Okay, this is number one. If you are living alone on this planet, probably that would make sense.
Mm-hmm.
Okay, but you're not living alone on this planet. I mean, there's a lot of people that you get in contact with. So, again, probably eventually everybody will get it, but again, we need to flatten the curve. Look at the numbers. They say that every infected person, even if he was just a carrier without symptoms, I mean, he can infect up to 5 people. Out of those 5 people, I mean, how many sick ones? I mean, I want you to look at your neighborhood, your neighbors. Okay, how many on dialysis? How many open heart surgeries? How many? I mean, those are people at risk. So no, that's wrong. You don't need to put those people at risk. Okay, because when you get the disease, when it's not just you; it's the people around you too.
This takes us to treatment, and you're an infectious disease specialist. You've been in the front lines. You've been working tirelessly these last few weeks or several weeks, and you've treated patients with coronavirus of all different severities in different settings, also in the ICU. So what are the treatments that we have currently available to treat these patients? Are antibiotics effective? Are retrovirals effective? What about plasma donation? All those things.
The cases that I dealt with, we used, I mean, some of them we just used, conservative management, which is basically every respiratory virus infection, those guys usually get into what we call superimposed infection, which is a bacterial infection on top of the virus infection. And this is usually the dangerous thing about, influenza, is the Streptococcus pneumonia you get after the influenza, or the MRSA pneumonia that you get after the influenza. So supportive care with antibiotics, adequate hydration, bronchodilators, good oxygen delivery until their immune system overcomes the virus and they're good to be discharged. I mean, this is I think the most important thing. Now you have this minority of patients who go into respiratory distress, severely ill, and I've seen the protocol where you use azithromycin and chloroquine, hydroxychloroquine. I saw it in a few patients. Unfortunately, the sample that I got, they didn't do well. They had a lot of issues going on, either old age or multiple medical problems in addition to the COVID-19 infection. So things didn't go well. But there are some reports about hydroxychloroquine, causing a lot of improvement in some patients who were seriously ill. Right now, we hear some good news about remdesivir. I mean, I saw a couple of reports from, I think, a hospital in New Jersey and another one in Chicago. The one in Chicago says that you had 100-something patients, probably 130 patients, severely ill, some of them on the ventilator, and that a lot of them were able to be weaned off the ventilator using remdesivir. So this is, a very promising medication. Again, no clear-cut data yet, but it is shown to be promising. Now, the thing is, you need to take a closer look at this study. I mean, is it financed by the drug company? Okay, because the drug company is going to try the drug on patients who are initially doing well, so that they have favorable outcomes, so that they would sell well. Okay, this study, you need to make sure that it is a true double-blind study, where you have, the treatment arm and you have the placebo arm, and you compare apples to apples or oranges to oranges. You don't give it to like 35-year-old guy who just had runny nose and say, hey, he got better. Of course he's gonna get better. I mean, he's 35 years old. He's healthy, So you need to make sure that the quality of the study is reliable.
Yeah,
That's
not
my
everyone
point.
talks about that, and
Yeah.
that's probably a topic for a different conversation that hopefully we'll have in the future. But
Yeah.
how medications get approved is very controversial and
Yes.
interesting topic that we need to talk about more.
Yeah. Now, the other thing I wanted to comment on is the IVIG. I think this is the most promising treatment for extremely ill people. I mean, if we could get this immunoglobulin and you manufacture it on large scale and give it to sick people when they get sick initially, I think we can solve a lot of problems if this is a successful treatment. I'm hoping this will be the one that makes the trick.
And this is where you've had the disease, you recovered, and you donate your plasma so they can develop
So, yeah,
to treat actively infected patients. I know someone that was infected with coronavirus, recovered. She's young and she's healthy, so her main symptoms were headache and cough. She didn't even have a fever. It lasted about a week, and then she woke up one day feeling perfectly fine. She was asking me where to go and donate her plasma. She couldn't find anywhere, and I think right now it's just
Methodist downtown. Methodist downtown is running that research.
Yeah, at the Research Institute downtown. I know they're actively running trials for vaccines and for plasma donation and serum creation. Yep. Well, thank you very much for taking the time
My pleasure.
Today to talk to us about this. And any final comments?
Yes, stay safe, guys. Social distancing. I mean, we still don't know how this thing is behaving. I mean, if you read the expectations about what's going to happen in the future, a lot of people say that we're going to have it up to 2022. Some people say 2025. That's going to travel the world, go to this, southern hemisphere, then come back again next autumn. I mean, just stay safe. Just, act reasonably, and just stay safe. I mean, especially if you have some, predisposing conditions such as, diabetes, high blood pressure, if you're elderly or something like that, just keep the social distancing for now until we figure out what's going on.
Or if you live with someone with those risk
factors. Exactly.
Well, thank you, Mohammed, and I'll talk to you soon.
Pleasure and honor to be with you, buddy. Have a good day.
You too.
Thank you. Bye.
Okay, guys, so this was a very interesting conversation with Dr. Mohammed Khirfan, infectious disease specialist, actively treating patients with coronavirus. We learned many things. We got a lot of questions answered. And for example, we now know that even though we could get access to a test, if we don't have any symptoms, it could be a good idea to leave those tests for people that have symptoms. And if you have symptoms and you get tested and are negative, he recommends maybe getting the test again in a couple of days because you might be positive 2 days later. So I hope to have more conversations like this with him in the future, and thanks for listening in.